Hello everyone, and welcome to the Health 999 channel. Today, we're going to talk about a very important topic for women's health, especially for older women: breast cancer. Breast cancer is one of the most common and potentially dangerous diseases, especially when it's detected late. However, if the signs are recognized early, treatment can be much more manageable. In today's video, we'll go over 10 warning signs of breast cancer that older women should watch out for. If you or someone you love notices any of these signs, don't hesitate to see a doctor. 1. Changes in the breast or nipple. One of the earliest and most noticeable warning signs of breast cancer is a change in the appearance or texture of the breast or nipple. For many women, especially those in their senior years, these changes may be subtle at first, but paying close attention could save your life. Start by knowing what's normal for your body. If you've always had a certain shape, size, or skin texture, then any shift from that baseline might be worth checking. Some women notice that their breast seems swollen, unusually firm, or has a lump that wasn't there before. In some cases, one breast might start to appear noticeably larger or lower than the other, even without weight gain or hormonal changes. The nipple is another key area to observe. Nipple inversion, where the nipple starts to turn inward instead of pointing outward, can be a warning sign, especially if it's a recent development. Other changes include redness, scaling, or thickening of the nipple or surrounding skin. These might resemble a rash or irritation at first, but if they persist, it's important to have them looked at. You may also notice discharge from the nipple, which can range from clear to milky or even bloody. Discharge that occurs without squeezing or stimulation is especially concerning. While not all discharge means cancer, any unexpected fluid should be evaluated by a healthcare provider. In some women, the skin on the breast or nipple may take on an unusual appearance, such as becoming dimpled, puckered, or looking like the skin of an orange. This condition, often referred to as peau d'orange, can be a sign of a more aggressive type of breast cancer. Remember, just because you're older doesn't mean breast changes are normal. Aging does bring shifts in hormone levels and body tissue, but significant or sudden changes should never be ignored. If you notice any of these signs, especially if they appear on just one side of the body, make an appointment with your doctor as soon as possible. Early detection is key, and something as small as a change in skin texture or nipple position could be the body's way of alerting you to a deeper issue. 2. Pain or discomfort in the breast area. Pain is something we often associate with injury or infection, but many people don't realize that persistent pain in the breast area, especially when it's not linked to the menstrual cycle, can sometimes be a warning sign of breast cancer. Now, let's be clear, breast pain by itself is not always a sign of cancer. In fact, many women experience occasional tenderness or discomfort in their breasts due to hormonal changes, especially before or during menstruation. However, in postmenopausal women, which includes most older women, those hormonal changes are no longer occurring in the same way. So, if breast pain appears without any clear reason and lasts for a long time, it becomes a sign worth paying attention to. The pain might feel like a dull ache, a burning sensation, or even a sharp stabbing feeling. It could be located in just one spot, or it might spread across the entire breast or underarm area. Some women describe it as a pulling or tightening feeling in the breast tissue, while others say it feels like pressure or heaviness. If this pain continues for more than a few weeks, it should not be ignored. Breast cancer-related pain is often not constant at first. It may come and go. That's what makes it tricky, because many women may think, it's just soreness, or maybe I slept wrong. But as the days or weeks pass, if the discomfort persists, that's when a medical checkup is truly necessary. Also, keep in mind that breast cancer can spread to nearby lymph nodes, especially under the armpit or near the collarbone. So, if you feel discomfort that seems to radiate into those areas, or if there's pain accompanied by swelling or warmth, this could be another sign that something isn't quite right. It's important to listen to your body. If you've noticed ongoing pain or discomfort in one breast, or if the sensation is different from what you're used to, don't try to guess or wait it out. Early action is always better than regret later. Speak with your healthcare provider. They may recommend a clinical breast exam, a mammogram, or an ultrasound, just to be sure. Remember, pain is your body's way of telling you something. Don't ignore it, especially when it comes to your health. 3. Lump or mass in the breast. A sign you should never ignore. One of the most common and noticeable signs of breast cancer is the presence of a lump or mass in the breast tissue or underarm area. However, It's important to understand that not all lumps are cancerous. Some may be benign conditions like fibroadenomas or cysts. Still, knowing the difference and staying alert can make a huge difference in early detection. Cancerous lumps often have certain characteristics. They tend to be hard, painless, have irregular edges, and don't move easily when touched. Sometimes, they're located deep within the breast tissue, making them hard to feel unless you're specifically checking for them or getting a routine screening. For older women, breast tissue often becomes softer and less dense with age, which may actually make it easier to detect a lump. But unfortunately, many women ignore these signs, thinking it's just a part of aging, a result of hormonal changes, or maybe even a harmless bump from a minor injury. This kind of thinking can delay diagnosis, and that delay can be dangerous. The truth is, any lump, whether small or large, soft or firm, should be taken seriously. If you notice a new mass in your breast or underarm area, the best thing to do is see a doctor as soon as possible. Your doctor may recommend a breast ultrasound, a mammogram, or even a biopsy to determine whether the lump is cancerous or benign. It's also worth mentioning that lumps don't always appear in the center of the breast. They can be close to the surface, near the nipple, or even near the armpit. That's why it's important to check your entire breast area, including under the arms, during regular self-exams at home. Remember, early detection saves lives. Thousands of women beat breast cancer each year because they found a lump and got it checked early. Don't be afraid. Listen to your body, trust your instincts, and speak to a healthcare provider if something doesn't feel right. You are worth the care. 4. Skin discoloration. One of the lesser-known but very important warning signs of breast cancer is a change in the color or texture of the skin on or around the breast. While many people associate breast cancer with lumps or pain, skin changes can also be a key indicator that something isn't right beneath the surface. You may notice that the skin of your breast looks red, bruised, or irritated, even though you haven't injured yourself. This can happen when cancer cells block small blood vessels or lymph vessels in the skin, causing inflammation and a buildup of fluid. In some cases, this may resemble an infection, such as mastitis, which is more common in breastfeeding women. However, for older women, such symptoms should always be checked by a doctor. Another noticeable skin change is a thickening or dimpling of the skin, which can sometimes look like the surface of an orange peel. This condition is called peau d'orange, a French term that literally means orange skin. It is caused by the buildup of lymphatic fluid in the breast tissue, which is often a sign of a more aggressive form of breast cancer known as inflammatory breast cancer. The skin may also appear darker or lighter than normal, and there might be areas where the skin texture feels different, perhaps rough, scaly, or even itchy. These changes can be subtle at first, so it's important to regularly observe your body and become familiar with what's normal for you. Early detection starts with awareness. Some women may ignore these symptoms, thinking they're just caused by age, hormonal changes, or even irritation from a bra. But if these changes don't go away after a week or two, or seem to get worse, that's your body telling you it needs attention. The earlier these changes are evaluated by a healthcare professional, the better the chances of identifying the issue before it progresses. To summarize, redness, swelling, dark spots, thickened skin, or a rash on your breast are not things to ignore, especially if they appear without a known cause. Always remember, your skin can tell a story about what's happening inside your body. So, take a moment to look, feel, and trust your instincts. If something feels off, it's always better to get it checked out. Your health is worth it. 5. A feeling of heaviness or fullness in the breast. Another important warning sign of breast cancer, especially in older women, is a persistent feeling of heaviness or fullness in the breast. This may not always be accompanied by pain, and that's what makes it easy to overlook. Many women might associate this sensation with hormonal changes, aging, or even wearing the wrong bra. But if this feeling is unusual, comes on suddenly, or lingers without an obvious reason, it's time to take it seriously. So, what exactly does heaviness or fullness mean in this context? Some women describe it as a dragging sensation in the breast, like there's extra weight inside. Others might feel a dull pressure or swelling that doesn't go away, even after resting or changing positions. Unlike the temporary discomfort some experience during their menstrual cycle, this sensation tends to stay longer and may even get worse over time. This feeling can also be accompanied by changes in the shape of the breast. One breast may appear larger or swollen compared to the other. The skin might feel tighter, and the breast might look shinier than usual due to the swelling. In some cases, this symptom is linked to a rare but aggressive form of breast cancer called inflammatory breast cancer. This type doesn't always present with a noticeable lump, but instead with swelling, redness, and a sensation of fullness or warmth. It's also important to note that the feeling of fullness can occur even without visible external changes. That's why listening to your body is so crucial. If something feels off or different from your usual, don't ignore it. Many older women, especially those who are postmenopausal, may dismiss these symptoms as part of getting older. But the truth is, breast cancer risk increases with age. Most breast cancers are diagnosed in women over 50, and symptoms can sometimes be subtle or feel normal at first. So, if you ever feel persistent heaviness, tightness, or fullness in one or both breasts, especially if it's a new sensation, please don't hesitate to speak with your doctor. Early detection saves lives. 6. Nipple discharge or unusual bleeding. One of the warning signs of breast cancer that often goes unnoticed is nipple discharge or bleeding, especially in older women. While this symptom can sometimes be caused by benign conditions, it's crucial to pay attention, particularly after menopause, when such changes are less likely to be hormonal and more likely to indicate an underlying issue. Normally, nipples should not produce any fluid unless a woman is breastfeeding. So if you notice discharge that is bloody, pink, brown, or even clear, it could be a red flag. Many people assume that only bloody discharge is a sign of cancer, but in fact, any unusual fluid, whether it's green, yellow, or cloudy, should be taken seriously. These fluids might appear spontaneously or when the nipple is gently squeezed, and often only on one side. In some cases, this discharge may be due to non-cancerous causes like ductictasia, a clogged milk duct, intraductal papilloma, a small benign tumor in the milk duct, or hormonal fluctuations. However, it can also be a sign that abnormal or cancerous cells are growing inside the milk ducts, a form of breast cancer that may not cause a lump or any pain. The key here is not to self-diagnose. If you notice any kind of nipple discharge, especially if it's persistent or only from one breast, you should consult a healthcare professional. Your doctor may recommend a mammogram, ultrasound, or even a biopsy to determine the exact cause. Early detection makes a huge difference. What might seem like a minor symptom could be your body's way of signaling a more serious problem. Listening to those signals, and acting on them promptly, can lead to faster, more effective treatment and better outcomes. So if you or someone you love experiences unusual nipple discharge or bleeding, don't ignore it. Get it checked. Taking action today can protect your health tomorrow. 7. Changes in breast size. One of the noticeable signs of breast cancer is a change in the size of one or both breasts. If you notice a significant change in the size of your breast, particularly when only one breast changes, it could be a sign of a serious issue. This change in size may include one breast becoming larger or smaller than the other, or one breast feeling swollen or more firm than usual. This change can occur due to the development of a tumor in the breast tissue, which can lead to fluid buildup or structural changes in the breast tissue. Particularly, if there is a tumor in the breast, it can cause a change in the size or shape of the breast, making it look different from before. In some cases, the change in size can happen suddenly and without an obvious reason. In addition to size changes, the shape of the breast may also change as a sign of breast cancer. The breast may become uneven, dented, or deformed. This happens because the growth of a tumor can affect the symmetry of the breast. Some women may also notice small indentations or other unusual marks on the surface of the breast. It's important not to ignore any changes in the size or shape of your breast, even if they are not painful. Some breast cancer tumors may not cause pain, especially in the early stages, so a change in size or shape could be the first noticeable sign. These changes can happen suddenly or gradually over time, but in either case, they are worth paying attention to. Monitoring changes in breast size and noticing any abnormalities will help you detect the early signs of breast cancer. If you notice one breast becoming larger or smaller than usual, or if you see any changes in its shape, you should seek a doctor's checkup immediately. Regular monitoring and keeping track of breast size changes can help detect breast cancer at an early stage, improving the chances of successful treatment and recovery. Remember, performing monthly breast self-exams and having regular health checkups are crucial, especially for older women. If you have any doubts about changes in your breast size, don't hesitate to consult a doctor for advice and tests. 8. Pain or swelling in the underarm area. One of the noticeable signs of breast cancer is pain or swelling in the underarm area, especially if the pain or swelling has no clear cause. This can occur when breast cancer cells spread and affect the lymph nodes under the arm. Lymph nodes are part of the immune system and play an important role in helping the body fight infections. They are found in various areas of the body, including under the arms, neck, and groin. As breast cancer progresses, it can metastasize, meaning cancer cells from the breast will travel through the lymphatic system and invade nearby lymph nodes, especially those under the arm. This can lead to swelling or pain in this area. When the lymph nodes are attacked by cancer, they can become hard and immovable. Swelling under the arm can be quite noticeable, especially if there is no clear reason for this change. Pain or swelling can be a rather vague symptom, so many women don't realize this is a sign of breast cancer. This is particularly true for older women, as other health problems like inflammation or infection can sometimes make identifying cancer more difficult. However, if the swelling or pain in the underarm persists or does not subside after a period of time, it's important to see a doctor. In addition to swelling, sometimes a woman may feel a heavy or uncomfortable sensation in the underarm area. This change might not always cause severe pain, but if you notice a difference in how your body feels, don't hesitate to consult a doctor. A doctor may perform tests such as ultrasound, X-rays, or biopsy of the lymph nodes to check for the presence of cancer cells. If detected early, breast cancer can be treated more effectively, and controlling the spread of cancer cells becomes much easier. It is important to pay attention to any changes in your body and seek medical advice if there are any unusual signs, especially when you feel pain or swelling in the underarm area without a clear cause. Early detection and intervention are key to effective breast cancer treatment. 9. Fatigue and unexplained weight loss. Fatigue is a very common symptom and can occur in many different medical conditions, not just breast cancer. However, when fatigue persists without a clear cause, it could be a sign of a serious issue, including breast cancer. Especially if this fatigue doesn't improve even with sufficient rest or changes in lifestyle, it's important to pay closer attention to your health and seek medical advice. One of the main reasons why cancer patients feel fatigued is due to the body fighting off cancer cells. Breast cancer can lead to a variety of issues such as hormonal changes, inflammation, or increased energy expenditure as the body works to combat the disease. This fatigue can feel like complete exhaustion, and it's not the same as regular tiredness after a long day at work. In addition to fatigue, unexplained weight loss is also a significant warning sign. Some women may experience rapid weight loss without changing their diet or activity level. This could be a result of metabolic changes caused by cancer. As cancer cells grow and multiply, the body uses more energy to sustain life, which can lead to weight loss, even when you're not intentionally dieting or exercising more. Unexplained weight loss could indicate that the body is not receiving enough nutrients or energy to maintain normal function. This can be due to the impact of a tumor or cancer cells altering the way the body absorbs and utilizes nutrients. Additionally, some individuals may experience a loss of appetite or a diminished sense of hunger, which leads to a decrease in food intake, further contributing to weight loss. If you experience both of these symptoms, fatigue and unexplained weight loss, over a prolonged period, it's important not to self-diagnose but to consult with a doctor. While these symptoms don't necessarily mean you have breast cancer, they could indicate a serious health issue that requires timely diagnosis and treatment. Early detection and recognizing the signs of breast cancer will make treatment much easier and more effective. Don't hesitate to see a doctor if you notice any of these symptoms. 10. Shortness of breath or persistent cough. Another important warning sign of breast cancer, especially when the disease has progressed or metastasized, is the feeling of shortness of breath or a persistent cough with no clear cause. When breast cancer spreads, it can metastasize to other parts of the body, including the lungs. This can cause respiratory symptoms such as a long-lasting cough, shortness of breath, wheezing, or even chest pain. Specifically, a persistent cough without any symptoms of a cold or pneumonia can be a sign that the cancer has spread to the lungs. As the tumor grows in the breast, cancer cells can travel through blood vessels or lymph nodes to other organs, including the lungs. Metastatic breast cancer to the lungs can cause symptoms such as a prolonged cough, coughing up mucus, especially if it contains blood, and feelings of breathlessness. Shortness of breath can also be a sign of pleural involvement due to metastasis. The pleura is a thin membrane surrounding the lungs, and when cancer invades this area, it can cause fluid buildup in the lungs, leading to feelings of breathlessness. This can occur without any clear symptoms until the cancer has reached a more advanced stage. It's important to note that not all cases of persistent cough or shortness of breath are related to cancer. However, if the cough lasts for more than 2 weeks or if the shortness of breath doesn't improve, it's a sign that you shouldn't ignore it. This could indicate a serious underlying health issue, and you should consult a doctor for a thorough examination. The doctor may perform tests such as a chest X-ray, CT scan, or other imaging procedures to determine the exact cause of these symptoms. Additionally, if you are an older woman with a family history or other risk factors related to breast cancer, experiencing shortness of breath or a persistent cough becomes even more concerning. Don't hesitate to get checked early to detect any potential issues in time and to explore appropriate treatment options. As you can see, breast cancer doesn't just have one clear symptom, it can have many different signs. Early detection of these signs and timely consultation with a doctor is extremely important. If you or a loved one notice any of the signs mentioned above, don't hesitate, make an appointment with a doctor right away for a checkup. Don't forget to subscribe to the Health 999 channel to receive more useful health information. Thank you for watching the video, and I wish you good health.